Okay, so our final speaker this morning is Anna TARASOFF. Anna is the National Practice Manager for Business Intelligence at Data Insights Intergen. So Anna has a wealth of experience in creating data governance strategies and information technology plans for a range of businesses, from financial services through power and utilities, telecommunication and manufacturing, to local and national government. She has expertise in assessing problem areas and recommending solutions that affect profitability. So today she's going to talk about business intelligence, analysis of trends and data.
Thank you. Thank you very much. So my presentation will be about wearable devices. I'm sorry, it's not going to be as entertaining as David's one. It was very hard to keep up, that's for sure. But what I will be talking about is effectively how technology changing the face of healthcare. So we talked about wearable devices, and we saw some numbers from David's presentation, some numbers from other sources like Forbes. At the moment in the States, they predicting the trends in 2016. And one of them is about 6 billion connected devices will be across worldwide. That's what they're thinking about it. And about 47% of people will be wearing some kind of devices which measure any characteristics of those things. And Tractica is the marketing company, which dedicated to research on how people interact with technology, saying that 17.8 billion will be spent on marketing and actually buying and purchasing those wearable devices. Question is, why do we care? Why do we care about all of those things? And effectively, what is the difference for us in New Zealand and those things in America? The most important thing, as Nes has mentioned in the previous presentation, is technically taking the ambulance from the bottom of the cliff and moving it to the top of the cliff. So what we're creating with those things, and absolutely commodity devices, and David mentioned that it's not quite a precision, and it's true, because those devices are not precise. What we trying to achieve with those devices is identification of trends, and ability to segment a person within a particular bigger segment and compare a person to the segment and how a person is doing within this segment. So ability to remotely track with a minimum interruption, remotely track patients' health, ability to look at the long term of trends and maybe immediate trends as well. Ability to predict any risk, as there are some sophisticated algorithms which allow us to measure interval between person's heartbeats and either any skips between that raises an alert. And more preventative healthcare. It's not acting after the fact or if something happens. It's actually acting when it's about to happen. And again, personalized healthcare. That's what we all striving for. That's Nes mentioned as well. What will make the difference is the personalized healthcare. So let's have a look at maybe some real life examples. But before we get into the real life example, we dealing with many clients and many customers in this similar situation. We understand that this project of wearable devices could be quite handful, and it could be quite long. So the major challenges on this one, again, what data to collect? With this data is accurate? Do we need this data to be accurate? What are we trying to measure? What are those trends we're measuring? And so on and so forth. What are we doing next? So all of those things can be daunting. Even the proof of concept can take quite a lot of time. And so what we have, effectively what we have learned from a previous experience, we need to start with a small step towards achieving something and towards creating some customer experience. So one of those real-life examples is Dartmouth Hitchcock story. So Dartmouth Hitchcock is a non-profit medical organization in the United States. of America. We worked alongside Microsoft with creating a proof of concept for Imagine Care for Dartmouth-Hitchcock. So Dartmouth-Hitchcock serves about 1.9 million people in the US and covers a range of specialists and healthcare professionals of all sorts of areas. So maybe just show you the video instead of talking about it.
The U.S. healthcare system is challenged by the task to deliver exceptional, personalized care at a lower cost. Despite spending nearly 1/5 of our gross domestic product on healthcare, we struggle to meet this goal. Financial pressures on care providers are increasing. This isn't sustainable. So how can we deliver high-quality, personalized care that patients deserve, given the cost pressures we face? At Dartmouth-Hitchcock, we've created Imagine Care, a new cloud-based solution built on Cortana Analytics Suite and Microsoft Dynamics that enables providers to help patients achieve better health. With the help of Microsoft, Dartmouth-Hitchcock is building a technology platform to serve healthcare organizations and patients across the country, setting a new standard for personalized care. Now, using machine intelligence, providers can develop a care plan that's unique to each patient. We can monitor patients from their homes, where data is collected from devices and sent to the cloud, to Imagine Care's 24/7 contact center, where registered nurses continually monitor a patient's health status and potentially serious trends.
Cortana, summarize health status for Ben Andrews.
Ben Andrews' weight has increased more than 2 pounds in the last 24 hours. Please review the home diuresis protocol prescribed by Dr. Phillips.
Patients get reminders and encouragement and dynamic updates to their care plans, improving their health, helping them avoid unnecessary trips to the emergency room, and reducing the cost of care. With support from loved ones and real-time interventions, there is less likelihood of readmission. With Cortana Analytics Suite and Microsoft Dynamics, we're transforming the way healthcare is delivered today, improving patient outcomes, reducing costs, and offering an unprecedented level of personalized care.
As I've mentioned before, we worked alongside Microsoft to create experience of us and a patient portal where all of this information is collected. We were using Microsoft Bands, just a really commodity variable, which costs not that much. And while it's not precise, it gives the right trends to us. So I have to switch off the screen to, unfortunately, this laptop doesn't have the internet connection, which I was planning to show you. I'm just planning to show with yeah, it's great. So that's already there. So that's what I was going to show you, what's behind this video. It's a patient portal. It's a mission control portal, which drives all of those things together. So as you can see, it's like an aircraft mission control, pretty much. What it does, it summarizes a health status across several thousand of those devices, and those several thousand devices bring everything into one dashboard. So those KPIs, as you can see here, based on a number of critical patients within a particular area. So if we have anything above 4%, it goes into the red and yellow territory. So again, all over there, because we have an ability to bring at the moment not just wearable devices data, but we can overlay the weather data, we can overlay temperature data as well on top of that, and any flu outbreaks or any disease outbreaks which can be collected from public sources. So that's a variety of data sources we're collecting all together and presenting it as a mission control to people. And if we look at a particular patient, say for example, Ben Andrews was in an example in a video. If we look at a particular patient who is currently highlighted as a risk, he is currently highlighted, if we click on it as a person, he's currently highlighted as a risk because his blood pressure has increased lately, and his heart rate is increasing and not quite stable. So we can have a look what's happening with his overall status altogether. And obviously we're not quite happy about his blood pressure being 165 over 100, so it can drill down into his blood pressure further down. We can communicate with Ben straight away if we wanted to. We see that his weight has increased as well. He possibly haven't done the exercises he needed to do and all other things which he actually needed to do. So it would be quite easy for us to give him a nudge from this portal if I would be a nurse or a doctor, and just encourage him to do some other things. Or maybe something else happened. Maybe he's going through the difficult phase in his life and we need some more support for him. So as you can see, it's quite easy. Again, we're using a real commodity device which monitor people's health. The other thing as well, which is valuable in this exercise, we're collecting data from many other people who are sitting in the same segment with him, maybe the same age, maybe the same condition, and so on. And we can compare how his condition is deteriorating or improving against his segment. That's where the value of the exercise comes in, and that's where the most kind of personalized healthcare we can possibly start creating with all of the things. Analyzing all of this data, analyzing all of the things is quite difficult because it does require several statistical models underneath. I'm a data specialist, so I know how that works precisely. But that is the first step, and it's a first step effectively towards a better healthcare, more personalized, modern healthcare, and ability to predict the trends and ability to have a proactive healthcare with this one. So, and the sky is the limit. We can collect data from his tweets if we needed to, if he gives us the permission to do so. So the doctors can monitor not only his physical conditions, but his mental conditions as well, based on this sentiment analysis from those tweets. Right. And so with this one, so we had a look at it. How did we do that? Fairly simply, it does require a lot of planning and does require a lot of things to run. So we have the variables data. We can do Fitbits, we can do Microsoft bands, doesn't really matter. We can have weather data and different data feeds, including even social data analytics. What we do next with this data, we bring it securely into one location, connect the data all together, bring it all and set up alerts, rules, and management rules on this data, set up sophisticated statistical models behind this data to be able to track it and see how that's all working. And based on this, we do dashboards and visualizations, similar to what I have shown you at the moment for Dartmouth-Hitchcock. And after that, which is the most important thing, we set up the system which fits back into the healthcare system. It would be a shame to have something like that without the feedback to your day-to-day portal, patient portal, healthcare systems, and so on, different management systems, which allow us to learn more as the history goes, learn more about the patient, allow us to refine the portal, and allow us to find new ways of treating people as well. And obviously do trends analysis. So as the outcome of this one, we have a lot of historical data about a lot of patients, which we're able to compare, which we're able to analyze, and therefore draw conclusions out of it. We have evidence-based care pathways as opposed to guessing. And this data is very valuable to the doctors and to the patients too. And we can create personalized plans based on this one. And remote monitoring obviously helps with emergency alerting. So if a person needs to be admitted in emergency department, so be it. But what we try to do, we try to minimize this emergency department visits with a proactive healthcare. And obviously we have real-time data, which is quite helpful and literally saves lives. And where is the future for the wearable technology? if you would ask me, we have heard about insertable devices. If you have heard lately, there are swallowable devices which actually which do not require a battery, so the stomach acids act as a battery for the swallowable devices. They specialized devices. We have those commodity devices, which are wearable devices like Fitbits and so on. So all of this together, I think all of the data coming from this precise medical devices and non-precise commodity devices can be connected all together, so we can draw a better conclusion and we can learn way more about the patients than we currently know. And that could be used in a variety of cases, starting from rehabilitation for people who are trying to recover and tracking their progress, and possibly encouraging them with reminders about maybe taking the medication or taking a walk or doing any other things, and ending up with treating chronic disease conditions. So when people cannot do anything about it but maintain their health state. So currently we're working with another US company, which is Smith Laboratories in Minnesota. So we have created for them a patient portal for managing Parkinson's disease. Again, kind of using the commodity wearable devices which is available to us. This is tracking the patient seizures and reminding Parkinson patients to take regular walks, take exercises which clinically proven to improve their conditions. So that's one of the steps with technology and one of the ways technology can help with healthcare, and it's definitely a step forward and it's a way for the future. And I do agree with Forbes, it does have a lot of future for in terms of managing patients' health. So with that one, that's pretty much the very short presentation. But I will leave you with with a short video. It's a CEO of Dartmouth Hitchcock Medical Center talking about their Imagine Care.
In my office, I have a picture of a glass that's, some people might say, half full of orange juice. And I have that there because I want people to think, tell me why I would hang that as a CEO in my office. And some people say, half full, half empty. It's really the wrong glass. And I think what's happened with healthcare and a lot of things is people aren't willing to think differently, finding new solutions. Our society can no longer afford what I consider to be an unsustainable health system. We have to create a sustainable health system that's based on individual people and populations, one that's not based on market shares and volume, one that's done in new payment models, paying things maybe through a subscription versus everything you do at the doctor's office is paid for individually, and one that allows us to improve the population health globally, not just at an individual community or for one individual. So I imagine that the financial models of the future will be very different. And when we come to the hospital, we're only getting a snapshot of what actually happens to one individual. What we'd like to do is be able to be with that individual all the time so that we can actually prevent them from having to come to the hospital. The system should be about the consumer, the person in their family, not about the healthcare system. So Imagine, to me, opens all kinds of doors. It gives people the opportunity to think differently. Imagine that we had the right glass.
Well, thank you very much. Thank you very much for that. Perfect.